All right, let's get started. Good afternoon again, and welcome to our Wellbeing Webisode, Learning to Care for Ourselves While Caring for Others. I am Kelly, a wellness specialist with Geisinger, and with me today I have Sabrina Lyons. Sabrina is a clinical psych specialist with Geisinger. Today we're going to be talking about the impact of caregiver stress and discuss tips to take care of you. Just a little disclaimer, all of this information we're providing today is to increase your awareness. If you have any concerns about your health, medical conditions, we encourage you to speak to your doctor. But welcome, Sabrina, and thank you for joining us today. So according to Rosalind Carter, a former First Lady of the United States, there are 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is universal. So to start off, Sabrina, what exactly does it mean to be a caregiver?
So while being a caregiver can have many meanings and many specific roles, the basics of being a caregiver is whenever you are in the position of being responsible for the emotional, physical, moral, or ethical care of someone else.
Thank you for that definition. I think a lot of us usually think of the physical demands of caregiving, thinking of things that like helping buy groceries, maybe organizing medications, providing a ride to a doctor's appointment, that we don't often think of the emotional, the moral, the other aspects that you just quoted. But those jobs, those tasks, these often seem like things that we just do because it's something that needs to be done to help someone else. I would suspect that many of us are caregivers without even using that title. Sabrina, how common would you say being a caregiver is in today's world?
Something that everybody in this world has a role in. The level of caregiving that we participate in on a daily basis probably varies from individual to individual. But again, kind of hitting all the elements that we discussed, I think it's important to realize that we impact others, and many times, far more common, that many of us are caregivers in multiple roles. We are caregiving for multiple people and multiple things, pets included, at the same time. And so that is where this element of caring for oneself becomes extremely significant and important as we are giving so much to others.
Yeah, that's something that didn't, initially cross my mind, that we could be caring for multiple people at once. So that's a great point. Kind of going off what Sabrina just said, if you fit the description of a caregiver, you're definitely not alone. According to AARP and the National Alliance for Caregiving, the numbers of caregivers is rapidly growing year to year. Sabrina, why do you think the number of caregivers is growing so rapidly right now?
Well, I mean, there are a number of reasons. I mean, one of the most reasons, especially at this time, is we have a very significantly high population of senior citizens. And so I think that we are, even especially in the healthcare industry, in how much we are caring for folks that are of the older generation. And so we have that going on. And then there's also, I mean, to be very honest, there is an epidemic of opioid use and other drugs, which is increasing the amount of folks that are caring for children, grandchildren, great-grandchildren, and other relatives. And, then we add the COVID pandemic, where we have a lot of folks that have been unwell physically in the last 2 to 3 years, and we are managing that as well.
So a lot of factors boiling all together at the same time has increased this need for caregivers. I think many of us would say that caregiving can be very rewarding. For most caregivers, being there when a loved one needs you is a core value and something you wish to provide. But I think taking on this role can impact your health. Sabrina, what effects do we often see that caregiving has on our own health and well-being?
Can impact one's own, experiencing symptoms of chronic fatigue, difficulty sleeping if we're worried often about the care of the individual or their safety, difficulty with finding time to care for one's own basic needs, which leads to a variety of issues, increased physical health issues, as well as decreased wellness. We can also see people have significant issues with finances because they are now extending themselves into locations sometimes, or, their care also includes a lot of expenses on their own behalf. And so that can significantly impact physical, financial, and oftentimes it also affects their social well-being if they are no longer interacting with other individuals outside of their caregiving.
So a wide range of effects from caregiving. From some of the research I was doing, I saw that caregivers are at increased risk for developing various conditions like depression and are more likely than non-caregivers to have a chronic illness, especially high blood pressure, high cholesterol, and being overweight. The demands of caregiving for others can be very stressful. So caregiver stress is common. It can, like Sabrina just mentioned, negatively impact so many areas of your life and even lead to burnout. Sabrina, can you explain to us a little bit what caregiver burnout is?
Burnout is generally the sense of feeling removed from your former self, having more of the world, being easily agitated, as I mentioned earlier, chronic fatigue, being very unresponsive to your own health needs, and can also significantly your ability to have self-awareness. Sometimes when you're so focused on caring for others and you're starting to reach the ability to withdraw and self-assess, so being able to identify when you're running in the red, so to speak. So it becomes really, really difficult, aware of your surroundings and how everything is impacting you. And as stated previously, it also significantly is embedded with sleep. You're no longer having adequate appetite, or oftentimes you will see people who no longer are caring for their physical health, meaning not attending regular appointments. They're long previously done so. Their overall attitude is negative. And sometimes, it reaches the level of hopelessness and understands what you're going through.
Thanks. Yeah, I think you really hit on how much caregiving can really affect your appetite, your sleep. So thank you for that. And I think it's sometimes probably hard, like you said, to take that hat off to differentiate the different areas in your life. You've mentioned it before, but as a caregiver, you may be so focused on your loved one that you don't realize your own health and wellness are suffering. But it's important to check in on yourself, on your health too. Sabrina, what are some signs or symptoms of caregiver burnout that we should watch out for in ourselves?
So once again, going back to any form of regular routine, and not just things happen, and we all know that life takes over sometimes. For a month, you have not engaged in any kind of structured meal or wellness, such as reading or care. Like some folks will sometimes say, I haven't gotten a haircut in 6 months. If that's something that normally you did every, you're losing touch of those pieces, the path that you were previously on. I also have other people commenting on your level of agitation or inability to make decisions, or the other symptoms of overwhelm that include high agitation, boredom, feeling detached, or feeling like you want to hurt yourself or others, then you really need to be that feeling of burnout.
Great warning signs to keep in the back of your mind and to check in on yourself. I believe the emotional and physical demands involved with caregiving can strain even the most resilient person. I think many of us will be, oh, that won't happen to me, but I really think all the demands that Sabrina has gone over so far, it really can affect you. So that's why I think it's so important that everyone who's a caregiver takes steps to avoid burnout. Sabrina, what suggestions do you have for a caregiver to avoid burnout?
So one of the goals in personal life, or likely both, as it is for most of us, the reality is that you approach it as you want. You know, finding that if you have things that are demanding in your life, like caring for multiple other individuals, care for yourself, and also even having components of your life that provide some self-care or personal medicine, such as socializing with others, keeping things on your calendar that are not part of your caregiving component. I think it's also really important that if life that was a positive, that it was helping keep you well, disappears or ends, maybe it was a service you were, that ends for a season or for another reason, replacing it with something else. And it doesn't have to be, but remember that you want to build a safety net under you as a caregiver that allows you to be with the hardships of caregiving. Sometimes that includes, seeking out somebody for your own counseling and therapy, include, medication management if you're really struggling with some anxiety, and other forms. Can include finding a support group. A lot of people are doing that via social media these days. Caregiver, it can be on your own timeline. A lot of people via the support group. They can find groups on there that run all hours of the day, because a lot of folks are, from other different time zones, and it doesn't allow you to commit the same time frame every week, but it would allow you to hop on and, find, I think also attending to all of your daily routines of health, keeping, getting yourself some time away from the individual that you're caregiving is vitally important.
Yeah, taking breaks, taking, time for you. You've mentioned self-care a few times today, and when it comes to self-care, I've heard and seen the following analogy a lot. When you're on an airplane and if an oxygen mask has to descend in front of you, they encourage you to put on your own oxygen mask before you assist someone else. And what they're saying is only first when we help ourselves, when we take care of ourselves, can then we effectively help others. Caring for yourself is one of the most important and one of the most often forgotten things you can do as a caregiver. When your needs are taken care of, the person you care for will actually benefit too. Sabrina, would you agree with this analogy and advice? And does taking this time to practice self-care really make you a better caregiver?
I do agree. A lot of components in truth of how well we can take care of others when we are serving ourselves, initially, and making sure we are well. I think it's really important. Probably the thing that most people struggle with as caregivers is really they are part of the circle when they are caregiving. They often that they're caregiving for as the primaries, and I think it has to. I wouldn't necessarily always agree, but I think you need to put yourself on the same line. You need to put as much value in taking care of yourself as others. That is really important. And as much as it's intentional to take care of yourself, I think it's also very important that you're intentional about on a daily basis. And if you're checking in every morning, with yourself, feel physically, how do I feel emotionally, what do I think, I need more help with, others to help you keep yourself well is vitally important. If you want to be able to maintain giving for the other individuals.
Great. Yeah, I think that's great advice. And like we've also said throughout today's webisode, caregivers often have to juggle multiple roles, multiple busy schedules. From the research I did, caregivers aren't just full-time caregivers. Most caregivers still work outside of the home. I think nearly 60% is what the stat that I found. 60% of people who are caring for one or more people still have a part-time, full-time job outside the home. The care receiver, the person you're caring for, has needs. Your spouse has needs. Your children that you might have needs. Your job, your employer, your coworker, they have needs. So I think this is one of the reasons that practicing self-care often gets pushed so low on our to-do list. But I suspect that many caregivers think putting their needs first, or at least a little bit higher on that list, is selfish. Sabrina, what recommendations do you have for someone struggling to find that balance between prioritizing their care, their, health, and taking care of others? How do we find that balance?
Well, I think first and foremost, one of the things to remember is that will go a long way. And when you're trying to determine how to split your time among your independent and others who need our care as well as the care receiver indicated, I think it's important to really focus on not necessarily making grand gestures, little respites throughout the day, the weeks, and the months where you are providing, some really quick, if nothing else, emotional where you take breaks, You, as I mentioned earlier, being 5 minutes where you can just turn on if you're really like struggling with feeling well, or 5 minutes where something that's going to tire you out so you can't do your other things, but refresh and give you a different perspective that infuses some self-care and what I keep calling personal medicine as well throughout. Personal medicine is things that you do, not, a medication that you take to stay well. So finding that is, something that being intentional and making a plan to do so. Is that you're having a hard time hearing me? Okay. I think one of the other struggling is if you are struggling to create yourself, maybe elicit the support of either professional or yourself that could help you figure out things that maybe you have that you might be able to infuse back in to help you get back on track.
Okay, so yeah, I think what I gathered was, it doesn't have to be these large, grand gestures of what you're calling or personal medicine or self-care, but, weaving time in here and there to still prioritize our needs. And I love the point you ended with about asking for help. So that was kind of the last point that I had for today. If you're like many caregivers, you probably have a hard time asking for help. You're the first one there to help, but probably not one of the top ones to ask for help. But that attitude can lead to feelings of isolation, frustration, and even depression. So rather than struggling on your own, take advantage of local resources for caregivers. Sabrina, are there any resources? I think you hit on some of the groups on social media, but is there any more you would like to elaborate on resources for caregivers out there?
Break, and that is definitely something that is largely needed on a much broader scale, especially considering the high level. Unfortunately, I can't cite any specific ones at this time that I can think of. I would again go back to this is, something that a lot of folks specifically find great support groups, sometimes in communities and even in hospitals and some other public settings that people can access. Some groups even set up through, local YMCAs that are helping individuals so that they can connect. And then there's obviously obviously always the option of seeking out work via therapy and counseling.
Yeah, I think just remembering you're never alone and seek out resources. I'm sure they are out there. But that is all we had for today. I want to thank you, Sabrina, for sharing your experience and your tips with us today. And I want to thank you all who tuned in to our conversation. I hope you found it useful and relatable. We do have a few minutes. If you have any questions, you can put them in the chat, come off mute. You're also welcome to send questions or feedback to Geisinger or to wellness@geisinger.edu. And we invite you to join in next month for our conversation on sleep health and the implications of not getting enough. So we thank you. We'll hang tight for a minute or two, but for any questions, if not, have a great day.